Good morning and welcome on behalf of the Heart and Stroke Foundation of Nova Scotia. My name is Fran Dunn and I'm the Physical Activity Coordinator, and we're thrilled to have you in our Make a Move session this morning. Really what we're trying to accomplish is provide you with access to information around physical activity counseling, around its efficacy, and a little bit of background around the history of the initiative and our current rates of physical activity in Nova Scotia. So this is the first phase of a three-phase workshop that we're piloting and implementing around Nova Scotia here in late fall of 2008. So we're really pleased to have you with us here this morning. The other person that we're really very grateful to have with us here this morning is a dynamic Dr. Angie Thompson from St. FX University, and she's going to lead you through about 40 or 45 minutes or so around those exact topics, the efficacy, evidence for physical activity counseling, and some background information. So I'll throw it over to Dr. Angie Thompson at St. Martha's Center in Antigonish.
Great, thank you very much, Fran. I appreciate that introduction, and I hope the dynamics actually comes across on, you will obviously be watching this web-based, so welcome everybody from me as well. The first slide that you are seeing is a workshop outline, and this outline is what we would actually have for you when you would come to attend a workshop. I'm just going to talk briefly about this outline, let you know what it is that you will actually see when you come for the in-person one. So this is part one, and this is to give you the background. Normally when you come for a workshop, we would do some introductions and get to know one another a little bit so that we can have a nice session that will be interactive. What I will talk about today is the evidence for the efficacy of physical activity counseling, and also the overview of the physical inactivity problem and the important role that you will have to play. Things that you would expect at the next session then would be community linkages and the patient education resources. We do some work and actually work with one another doing some minimal intervention, talking about the PACE Canada, the tools and strategies. Of course, we'd have a little snack break with a healthy little snack. Then we would spend some time with some clinical scenarios and then talk about those scenarios, and that would be an opportunity for you to share some of the difficulties that you're having with your physical activity promotion. And then also a little bit of an implementation session and some closing, tell you what to come up for the third session that Fran was talking about. So I'll get started talking about the partners, everyone who's involved, the importance of your role as well. So in regards to this initiative, as you know, this is has been put together and is driven by the Heart and Stroke Foundation of Nova Scotia. Also involved is the Nova Scotia Department of Health Promotion and Protection and Cancer Care Nova Scotia. This initiative, there was a pilot that was completed in 2005, and then the first provincial workshops in 2006. It was formally evaluated, the provincial delivery system, in 2007, and to date, perhaps even a little bit more, because of course every time there's a workshop we can add to these numbers, more than 350 healthcare professionals across Nova Scotia have been trained. So we're certainly moving forward in getting people ready to promote physical activity. Acknowledgements to a number of people. I will let you have a look at that slide. You must recognize that an initiative like this takes a whole lot in getting it all put together, and there's a number of experts that have been involved. So the goal of Make a Move is to increase the quantity and quality of physical activity counseling by healthcare professionals in Nova Scotia. And these particular physical activity interventions are targeted at the apparently healthy, and we would define apparently healthy as all those who could respond positively to the PAR-Q, adults that are ages 18 and over. So although we can have physical activity counseling for children and youth, our focus is actually on the adult population, the population that you are mostly working with. So the objectives of this workshop, to be a little more specific, are to briefly and quickly review the health benefits of physical activity. That's part of what you will actually have the chance to review yourself before you get to the in-person workshop. To increase awareness of the recommended levels of physical activity for health benefits and what the current rates actually are in Nova Scotia and in Canada. To increase your awareness of your role as healthcare providers in promoting physical activity. It is a critical role, it's a respected role, and it's a needed role. Also, to increase your understanding the importance of linking clients to community resources and supports. Now that's what you would actually get the next time that you come in. We'll talk about what links are available and talk about some of the resources we know are available, and help you to think about what resources are available in your community. to review the stages of change theory and how it relates to health behavior change counseling. It's critical when you are promoting any lifestyle behavior that you understand a theory or several theories behind it, because it does make a difference in regards to the effectiveness of your promotions. To increase the understanding of and provide opportunities for practice of the minimal intervention using PACE Canada tools. This is all part of what you would get in the in-person workshop. Highlight the importance of follow-up, provide tools to assist patient tracking and follow-up as well. And the really neat thing is that when you take one of these workshops, you get all of these materials that really helps you in your physical activity promotions. And you can use the materials as they are, and you're often allowed to photocopy them as well, so it's not a high expense for you or your association. Also, to increase your understanding of how to use the decisional balance tool, that's the physical activity worksheet, to increase your understanding of how to address some of the common barriers to physical activity participation, to increase your understanding of ineffective and effective physical activity counseling. There certainly are some things we know from the research and from practice as to what works and what doesn't, and to increase your understanding of how physical activity counseling using the Make a Move toolkit can be implemented in your practice, and to give you some practical suggestions how to do so. And then the follow-up workshop would be a couple weeks after you've taken the in-person workshop to say, okay, how's it working? What are your struggles? How can we help you a little bit more? Here's some references for you. Certainly, if you ever wanted to Google any credible online research base, you can find lots of evidence that it is effective. Now, successful physical activity and interventions usually involve a multidisciplinary team. They involve people that come from it at different approaches. So a physician, other healthcare professionals, academics, so that we understand the process. It seldomly is just a one-step approach. If you actually look at I always call it the anti-smoking campaign. I'm not sure that's the exact right terms. The smoking cessation programs, those worked successfully and continue to work successfully because we've come at it from so many other ends. So it's usually my link. I think of smoking cessation and how we've been effective at doing that as a province, as a country, even as individuals. We need to use that same sort of approach in our physical activity interventions. Successful physical activity interventions use stages of change approach or some other theory of behavior change. There are actually about 4 or 5 fairly credible theories. The stages of change works really well because and we'll talk about it later, but it lets you know where an individual is at and how to address that person at that particular stage that they're at, because there isn't a cookie cutter model that works exactly for everybody. You do need to adapt for what the individual is. Successful physical activity interventions use written physical activity prescriptions. There's something about a person walking away with a piece of paper that they've signed and you've signed and says, this is what I'm going to do. There's more weight to them following through. It's really easy to say, yes, I should do that. When you start to put it on paper, maybe post it on the fridge, it really helps a lot. Begins with an interactive training session, something like what we're doing with some educational background for the facilitators. Uses an office support system which includes the clinical practice guidelines, provider reminders, and patient follow-up. These are all things that you will get in the PACE toolkit. And links patients to community resources, something I said earlier. We'll share some of our resources in person that we're aware of and help you to think about what's available in your community. What sort of things can you maybe create or collate a list of options for your patients or clients? And telling them, handing that to them can be helpful.